Honorable Ministers, the Deputy Minister of Health and Child Care, Honorable Dr. CHIWENGA, the Secretary for Health and Child Care, Commodore Dr. Jasper Chimeza, Chairperson of the Health Services Board, Dr. Paurinos Skosana, the Chief Executive of the Health Services Board, Ms. Kaseke, senior government officials, chief directors and directors of the Ministry of Health and Child Care, World Health Organization representative, Dr. Kasasira, UNICEF country representative, Ms. Mahamad, representatives of civil society organizations, provincial medical directors, seat health directors, distinguished guests, members of the Fourth Estate, ladies and gentlemen, good afternoon. It is with great honor and modesty that I accepted your invitation as the guest of honor for this year's World Health Day commemorations. The event is a brainchild of the World Health Organization, which was founded on 7 April 1948. The historic day marks the annual anniversary of the global health body. This year's World Health Day commemorations are running under the theme, Building a Fairer, Healthier World. This theme dovetails with the universal health coverage goal of ensuring that all people obtain health services they need without suffering and financial hardships by 2030. Among the 7 aspects of human security that were propounded by the United Nations Development Programme of 1994 is personal security, which embodies health security. Since then, public health assumed center stage in the collective security of communities and states. The theme, Building a Fairer Health World, seeks to mitigate inequalities that exist in the domain of access to quality health care services. Such deficiencies are gravitated by differing conditions in which mankind is born, grow, live, work, and age. The uneven access to quality health care is more prevalent in developing and less developed countries, the bulk of which are African states. The challenge beacons on the African Union, regional bodies, and governments to invest in the development of healthcare infrastructure to enhance service delivery. Basically, a nation is safe when it considers itself to be free from external or internal aggression, and when its citizens consider themselves to be free from poverty, famine, disease, or repression. Ideally, citizens should enjoy basic rights such as decent shelter, food security, and access to clean water, jobs, and adequate health services. Amidst our populace are vulnerable groups living with disabilities or suffering from non-communicable diseases like cancer, HIV/AIDS, hypertension, sugar diabetes, and other chronic diseases and injuries. In the public interest of public health, the government of Zimbabwe is leaving no stone unturned to improve the socio-economic livelihoods of citizens. Ample testimony of this determination is espoused in the government's vision of achieving a middle income status by 2030. My ministry also embarked on a robust health infrastructure development program aimed at improving the density of health care facilities, particularly in outlying areas. The program seeks to establish more health posts, health care centers, district and provincial hospitals, up to quaternary and quinary level hospitals. Twinned with the health infrastructure development program is also the digitalization of the health care system. The automation of health care services will help to create electronic databases, enhance accessibility by the generality of our Zimbabweans, and improve efficiency in the sector. Today, Zimbabwe joins the global community to commemorate the World Health Day of 2021 amidst the vagaries of the COVID-19 pandemic. The scourge has continued to claim a huge toll of casualties across the globe. As of 13 April 2021, the total number of deaths and active cases rose to 1,542 and 846 respectively. Meanwhile, the total confirmed cases and recoveries stood at 37,307 and 34,901 correspondingly. In tandem with this year's World Health Day theme, the government of Zimbabwe rolled out a vaccination program free of charge. My ministry is also encouraging that COVID-19 vaccines are distributed equitably without regard to class or political affiliation. Access to health care should not be a luxury reserved for the elite. The positive progress in the COVID-19 national response has thus far been successful as a result of initiatives being pursued by government and its development partners to ensure everyone has access to knowledge on COVID-19, testing, and care. So far, more than 200,000 people, health and other frontline workers were vaccinated. I also want to take this opportunity to urge the generality of Zimbabweans to desist from vaccine hesitance and to do the right thing till the nation achieves a herd immunity. My ministry is not only focused on the COVID-19 pandemic, but also other recurrent epidemics like cholera and typhoid. It remains of paramount importance that even as the government, with support from WHO and other development partners, works towards the eradication of these diseases, individuals should continue to uphold recommended preventive behaviors. I do not expect a situation where the nation moves from the COVID-19 pandemic to resurgent outbreaks of cholera and typhoid. Let me conclude my remarks by saying that building a fairer, healthier world is not the responsibility of government and development partners alone, but also communities and individuals. This year's theme inspires states towards improving investment in the health delivery system, political commitment, community empowerment for positive health-seeking behaviors, and access to quality health services. Ladies and gentlemen, we are all in this together. If we work together, we will promote and create, we will promote the creation of a conducive, fairer, and healthier world. I thank you.